Within the oncology care model, if you look at the expenditures associated with an episode and you think about it as a pie, the biggest piece of that pie, about 55%, is actually attributed to drug cost. The second biggest piece of that pie is about 15 to 20%, and that is actually what we term inpatient, which is defined as ED utilization and hospitalizations. And that is where navigators and care coordination become extremely essential. In fact, so essential that the oncology care model, part of the requirement for practices to join the model is that they needed to attest that they would actually have a navigator on staff. Now, there's no definition as to credentialing or or requirements for skill level or anything like that around the navigator. However, they are required to appoint somebody in the role of a navigator within the practice. Now, there's an aspect of the model called quality measures where they are adjudicated on how well they're keeping patients out of the hospital, essentially. And so there's not only a cost factor, but there's a quality metric that is impactful in the amount of performance-based payment that they actually receive from CMS. So when you're looking at care coordination, you're not just looking at, getting patients point A to point B. It's really also looking at their psychosocial needs, monitoring side effects, making sure that their financial toxicity levels are within range and are being addressed, right, proactively. So there's a lot that actually goes into that piece of it. What we find is the practices that have the most success in this model have a very robust navigation and care coordination team made up of several different expertise. So you have your clinical navigator, you've got your patient navigator that deals with the psychosocial, perhaps a social worker on staff that can also help with the psychosocial needs of the patient. You have a financial navigator as well that can assist with the financial toxicity piece. So there's a lot, it's a very much a coordinated team environment and where we find it to be most successful. However, it needs to be acknowledged also that there's a lot of practices that don't have the ability to have all those resources on staff. So, and we do work with some practices that are in that boat. So it's really understanding how can you leverage the resources you do have to sort of meet all those needs around that care coordination piece, because it is so uberly important.